Asterisk. Imagine your body trying to send you an urgent message, but you're too busy, too distracted, or simply unaware to notice it. What if ignoring that message could cost you years off your life? Today, we're talking about 5 subtle body signs that could indicate you have less than 5 years to live. And these aren't your typical warning signs. They're often overlooked, hidden in plain sight, and misattributed to stress, aging, or lifestyle. By the end of this video, you'll know exactly what to watch for, how to interpret these signs, and when it's time to take action before it's too late. And trust me, number 3 will shock you because most people dismiss it entirely. So stay with me. Your health could literally depend on it. Asterisk. Key points for this scene. Build urgency and curiosity. Establish credibility with science-backed claims. Create emotional connection. Viewers realize it could be them or their loved ones. Sign number 1. Trembling hands or legs. Asterisk. The first subtle sign is trembling hands or legs. Now, most people think, oh, it's just stress or caffeine, but repeated involuntary shaking can be an early warning for serious conditions like Parkinson's disease, peripheral neuropathy, or even cardiovascular problems. Let's break it down. Tremors are caused by irregular activity in the nerves or brain regions that control movement. When your hands or legs start to shake without reason, it's not just fatigue. It's your body signaling that something deeper might be wrong. Consider this. Studies show that Parkinson's disease affects nearly 10 million people worldwide, and early detection dramatically improves quality of life. Trembling hands, especially when accompanied by stiffness or slowed movements, can appear years before more severe symptoms develop. But how can you tell the difference between normal jitters and a serious tremor? Here are some key pointers. Frequency. If shaking happens daily, even with rest. Duration. Tremors that persist for more than a few minutes without obvious cause. Accompanying symptoms. Stiffness, slowed movements, balance issues. If you notice these signs, it's crucial to consult a neurologist. Early intervention can prevent progression and help you live a longer, healthier life. Asterisk. Supporting tips. Show visuals of healthy versus tremoring hands. Include statistics on prevalence of tremors. Brief anecdote of someone detecting a tremor early and improving prognosis. Sign number 2. Sudden fatigue or weakness. Asterisk. The second sign is sudden fatigue or weakness. Everyone gets tired, but if everyday tasks, climbing stairs, walking short distances, even getting out of bed, leave you drained, it can indicate serious underlying problems like heart disease, diabetes, or chronic infections. Your body constantly signals distress before symptoms become severe. Fatigue can stem from reduced oxygen supply, poor blood circulation, or metabolic issues. For instance, heart failure patients often report extreme tiredness, even with minimal activity. But what makes this sign tricky is that it's subtle. You might just think, I'm busy, I didn't sleep well, or blame it on age. That's exactly why it's dangerous. It can go unnoticed until it's critical. Look for these patterns. Persistent fatigue lasting more than 2 weeks without a clear reason. Weakness that worsens over time or affects one side more than the other. Shortness of breath, dizziness, or fainting episodes. Even mild symptoms can indicate serious problems. So early consultation with a physician can be life-saving. Asterisk. Supporting tips. Include a mini case study of someone ignoring fatigue and later discovering a heart condition. Explain biological mechanisms in simple terms. Oxygen delivery, heart function, blood sugar levels. Provide prevention tips. Proper rest, checkups, monitoring energy levels. Sign number 3. Unexplained weight loss or swelling. Asterisk. Sign number 3 is often the most shocking. Unexplained weight loss or swelling. Losing weight without changing your diet or exercise routine, or noticing swelling in your hands, legs, or face, can signal serious conditions like kidney disease, liver problems, diabetes, or even cancer. Your body stores and regulates water and fat carefully. Sudden changes mean something is disrupting that balance. Swelling occurs when fluid leaks into tissues, which may indicate heart, kidney, or liver problems. Meanwhile, rapid weight loss can be your body burning energy reserves due to disease, not dieting. Let me give you a few examples. Persistent swelling in the ankles and legs, often worse at the end of the day, may signal fluid retention from heart or kidney issues. Unexplained weight loss of 5 to 10% of body weight in a few months without effort is a red flag for metabolic or cancer-related conditions. Combination of both swelling and weight loss? That's an urgent reason to see a doctor immediately. Early detection of these signs dramatically improves outcomes. Studies show that catching kidney or liver disease in early stages can slow progression, reduce complications, and significantly extend life expectancy. Asterisk. Sign number 4, persistent pain or stiffness. Asterisk. Now let's talk about the fourth sign, persistent pain or stiffness. This one is deceptively common because most people assume aches and pains are just part of aging or daily stress. But when pain lingers, intensifies, or appears without a clear cause, it can be a silent warning of chronic conditions that may shorten life expectancy if untreated. Joint or muscle pain can arise from various sources: arthritis, cardiovascular issues, nerve compression, or even inflammatory disorders. Persistent back pain, shoulder stiffness, or knee discomfort may not just limit mobility. They might indicate underlying problems with circulation, inflammation, or organ health. Let me share a story. A 52-year-old patient came to a clinic complaining of mild knee stiffness for months. She attributed it to age and her active lifestyle. But upon further evaluation, doctors discovered early-stage rheumatoid arthritis combined with early heart issues. Prompt treatment not only relieved her pain, but prevented more severe complications. So, how can you distinguish harmless aches from dangerous ones? Consider duration. Pain persisting more than 2 to 3 weeks without improvement. Location. Symmetrical joint pain, both knees, both wrists, can signal autoimmune issues. Accompanying symptoms: swelling, redness, stiffness in the morning, fatigue, or unexplained fever. Ignoring these subtle signals may lead to decreased mobility, chronic inflammation, and increased risk of cardiovascular problems. Early detection through routine checkups and imaging tests can make a world of difference. Asterisk. Supporting tips. Explain biological mechanism behind inflammation, cartilage degradation, and joint stiffness in simple language. Mention lifestyle factors. Sedentary habits, poor diet, and lack of exercise can exacerbate issues. Include prevention and management tips. Stretching, anti-inflammatory diet, regular exercise, and professional evaluation. Sign number 5. Skin changes or bruising easily. Asterisk. Finally, we arrive at sign number 5. Skin changes or bruising easily. Your skin is the largest organ of your body and often acts as an early warning system. Unexplained rashes, spots, or bruises with minimal impact could indicate blood disorders, liver problems, or nutritional deficiencies. For example, liver disease can cause jaundice, yellowing of the skin, or abnormal bruising due to impaired clotting. Blood disorders such as anemia or platelet deficiencies may lead to persistent purples and reds appearing on the skin. Even subtle changes like dryness, scaling, or sudden pigmentation shifts can signal systemic issues. Here's a real-life scenario. A 60-year-old man noticed small bruises appearing on his arms without any trauma. Initially, he ignored them, thinking he bumped into objects. Months later, testing revealed a platelet disorder that, if untreated, could have led to severe complications. Early detection saved his life. Signs to watch for: frequent bruising with minimal or no injury, persistent rashes or skin discoloration, sudden changes in skin texture or unusual lesions, If you notice these changes, consult a dermatologist or a primary care physician promptly. Your skin often signals internal problems long before other symptoms appear. Asterisk, supporting tips. Explain in simple terms how liver function, blood clotting, and nutrient deficiencies affect skin. Include advice for self-monitoring. Keeping a skin diary, noting unusual bruises, rashes, or color changes. Encourage viewers not to panic, but to take signs seriously. How to respond and prevention. Asterisk, now that you know these 5 subtle signs, the next question is, what should you do? Awareness alone isn't enough. You need action. Here's a step-by-step approach. Track your symptoms. Keep a health journal noting tremors, fatigue, pain, swelling, or skin changes. Patterns matter more than isolated incidents. Schedule regular checkups. Annual exams, blood tests, and screenings can detect problems early. Lifestyle adjustments. Proper diet, exercise, hydration, and sleep are foundational. Reducing processed foods, managing stress, and staying active can dramatically improve health outcomes. Consult specialists early. Neurologists, cardiologists, or dermatologists may provide targeted care for specific symptoms. Educate yourself. Reliable sources, peer-reviewed studies, and professional guidance help you make informed decisions rather than guessing about symptoms. Remember, early detection is your most powerful tool. Subtle signs are often your body whispering for help before things escalate. Acting promptly can literally save your life. Asterisk, conclusion and call to action. Asterisk, your body is constantly sending you messages, sometimes in ways so subtle you might not notice. Trembling hands, sudden fatigue, unexplained weight loss, persistent pain, and skin changes are not just minor inconveniences. They could be urgent warnings. Don't ignore them. Listen to your body. Act early, and seek professional guidance. Life is precious, and catching these signs early can add years in quality to it. If you found this video helpful, share it with someone you care about, and subscribe to our channel for more life-saving health insights. Remember, your health is priceless, and knowledge is your first line of defense. Asterisk,